nutritional guide. Basically, what you should be eating with vegetables and fruits you should be eating, what you shouldn't be eating also. That's what every aspect. You don't eat meat, dairy, soy, and stay away from sugar. Basically, you got to look at, well, the analogy I make is your body is a Ferrari. Now, basically, I would treat a Ferrari like a stepchild, driving like a Rutabaker. So I got to clean my body out and reboot my body basically. I have some right here. I have some tonic electric. 2 bottles of that. Got 2 bottles of that tonic electric. I have some. This is Banju. I have some. There's 2 bottles of Banju right here. This is the sea moss battle rack mix. The Veneto right here. This is a male nourisher. This is it. Will pronounce that for me. I'm at a loss right now.
Chelation.
It's
a cell cleansing.
Cell cleansing, yeah. Like I said, my cognitive function is toe back. I'll admit it. Be that as it is. I was never the sharpest knife in the drawer, but I will cut you. Now I can't cut nothing. This right here is Lino. And basically, those are the herbs you take. Here's the daily intake forms. But here's what I really confused about. But it is what it is. So months before I even collected enough money to get to what I got right now, I said, let me figure out what he's telling me to eat and how to prepare it. So I went and bought the recipe book. I made copies for a lot of my friends. This is like the breakfast, lunch, and dinner to make it easier to follow. So I want to stick to the diet as closely as possible because I feel like, how do you know if it's working if you don't follow what he's saying? So I'm a very regimented in my life. I can cut sweets out. Only problem I've had in my whole life is really marijuana. I smoked a lot of marijuana, but I stopped. But knowing that, I know I can do anything. I mean, I grew marijuana, so it wasn't a big deal. I had more marijuana than I ever needed to smoke, and for me, it created dependency. But because of my disease, marijuana slows you down. I'm not gonna say marijuana is bad. It's bad for me because of my condition. I don't want to be I don't want my cognitive abilities even altered any more than they are now. I don't smoke as much. That's what it is. I don't want to smoke. I don't want to. I want to, but I know I shouldn't. So that's what it kind of with Dr. Sebi. It's like you have to reprogram your brain because what you're doing right now is not working. That's obvious. So if you don't want to kill yourself, you want to make yourself live. You gotta eat to live. You can't eat to die. That's what we're doing. We're eating. What's that, Will?
Do you want to talk about the myelin sheath and what that means? Because I think that's important.
Basically, MS is what you're doing. What's happening is your body's eating away its myelin sheath in your brain. Basically, if you can imagine a speaker wire, it's covered by a plastic outside with wires inside of it. What happened with MS is it's attacking the wire outside, the outside of the wires in your brain. It's eating away at it. So the signal is not traveling to your brain, to your necessary parts of your body fast enough to create a movement, a thought. So I mean, every time you have an MS attack, and even when you don't have an MS attack, the disease is eating away at your myelin sheath. So basically, my myelin sheath has been so corrupted. I'm in a situation now where I talk funny. I can't walk. I haven't ran in years. I can walk, but it's labored. I haven't not been able to jump. After CCSVI surgery, I could a little. Well, you saw me.
Yeah.
I can't do that now. I haven't played with my daughter. She's 4 years old, so she's basically been living with this disease as long as I have. I haven't been able to really do what I can do with her. Before it got really bad, I could do, I could take it to a park, do what I do, but now I can't do anything. And I'm not as crippled as most people are already in that. You know, some of us are already in that. But I'm not doing good. So I decided to go with Dr. Sebi because I called him, talked to the counselor. The counselor, her name is Jade. And basically, I call her and I talk to her about what I need to do and what's going on with me. And she prescribed the herbs that I just showed you or just read off to you to address all the functions that are going on with me. And basically, it costs me $750, I believe. Which is a small price to pay for health. And health is priceless, as I know now, right? And then consequently, after next month, you pay $500, and then after that, it's $375 for the rest of the duration of the treatment. But the herbs are only part of the problem. The herbs are part of the treatment. It's food. It's the food that you're eating. You know, you can't continue poisoning yourself. You can't get alcohol unless you dig alcohol. What we eat is digging the hole deeper. It's not getting into alcohol at all. So that's what it is. You saw it. It's sent to me in a tiny fashion. How I was getting it. Paid him to send it to me Federal Express the next day. Got it. So I'm about to embark on this journey. Do what Dr. Sebi says I should do. You know, with the help of my partner Will, I will keep you guys informed of how I'm going, how I'm doing. I'll let you guys know when I cheat, as far as my dietary habits. I'll even let you guys know if and when I do smoke weed. I haven't done it in years, but I do have an urge sometimes, but not strong enough to do it. But as I start getting better, or as need be, I'll let you guys know. Honestly, I'll be honest with you guys. I mean, I don't know you, you don't know me, but I'll be honest with you guys. Cause I want you guys, if this works, I believe it will. If it works,
what do you want the YouTube users to do for you?
I mean, follow me, and really assess what's wrong with you, and what you're doing about it. If what I'm doing works for me, I'm proof positive that what I'm doing works. So I would encourage you to really, start saving your money. Start saving your money and plan to go with Dr. Sebi. Like I said, it takes a year. It takes a year. The whole process is a year. Right now, I'm willing to do that. I have a family. I have friends. I have friends that I don't even go see anymore because I can't. And it's killing me. I have lost friends, relationships. All I want to do is not preach you. I just want to show you what I'm doing. I'm not going to preach you. I'm not going to preach you. Because either it works or it doesn't. I believe it works. And I want to show you that it works. If it indeed does. I believe it does.
What do you want to hear from them?
I want to hear your questions, comments, suggestions. I want your honest opinion, because I'm being totally honest with you. I don't know you from anybody. I don't know you. You don't know me. So there's nothing. Don't hold nothing back. You know. That's my telephone. Someone call me real quick. 1 second. My son. Hey fella, I'm gonna call you right back. I'm doing something right now. I'll call you right back. Yeah, my son's in LA with my mother and my nephew and my brother for the games, whatever. So what I want to do is I want this to be cathartic for me and for you. I want us to be able to build a relationship, however impersonal it may be, and help not only myself but help you in the process. You know, because this is my first time going through it. Hopefully last. But if you have any questions, I encourage you to type them in and ask me, and I'll answer them as quickly as I possibly can.
Do you want to hear from people who have been treated by Dr. Sebi?
Yeah, I do want to hear it. Yeah, if Dr. Sebi has treated you, let me know. There are plenty of Dr. Sebi videos on YouTube. I encourage you to look at them also. But if you've been treated by Dr. Sebi and it's changed, or it has helped you, I want to know about it. Because one thing, I've heard of people who know people who are cured by Dr. Sebi, but I've not heard anybody talking in first person. Like, this has worked for me. I'm proof positive this will work for me. That's why I want to do this. I want to show somebody that actually works.